Well, let's hear more now from CGTN's Patrick Oyet. He's in Juba for us. Patrick, what can you tell us about South Sudan closing down all the COVID-19 vaccination centers? What impact is this having in the country?
Yeah, Beatrice, this is the announcement that just came from the government, and as you rightly said, you know, when the 132,000 doses came in the country, the vaccination started moving very slow, and because of that, the government had to return 72,000 doses to COVAX facility, and later some went to Kenya, of course, and later they changed strategy. You know, before that, there were only 3 vaccination centers, for example, in Juba, but after realizing that very few people were turning up for the vaccination, the government had to open up and all health facilities in Juba, for example, were having the vaccines. They also moved the vaccines across the country. Every state had vaccines, and health centers across the states also had vaccines. So that made the process really to move faster. But also we are talking of a small number of vaccines here, not a very big number, because out of the 132,000, 72 were given back. So it was only 60,000 doses that really remain, and the government says, of course, it is now waiting for another batch of the vaccines from COVAX facility, because remember, there are some people who only took 1 dose and they are waiting for their 2nd dose. So they are saying that they hope they will receive this remaining or the next batch of the vaccine soon, so that they continue with the process. Basically, that's what is happening as far as the vaccines are concerned.
So as the country is waiting to get more vaccines there, Patrick, what is South Sudan's current coronavirus situation, and how is the government dealing with it?
Yeah, the current situation, according to government records, of course, more than 10,000 people have been infected by the virus, but 119 people have so far lost their lives as a result of the virus. Many people here still believe that the number of people infected could be higher, because the testing facilities are majorly only in Juba, and there are about 5 facilities that are carrying out this test, and people are not voluntarily going to conduct tests. You know, people only go for a test when they either want to travel somewhere, or because they are going for a certain occasion and they are required to have been tested. That's when you see people going for the test. So there's a thinking among many people that we talk to that the number of people infected could actually be higher, but just because many people are not carrying out the test, that's why the number looks small. That's about 10,000, and then those who have lost their lives are 119 in number. Yeah.
Patrick Oyet joining us there from Juba. Thank you.